For many people, the thought of air being injected into their bloodstream is a terrifying prospect. Stories about the dangers of air embolisms, pockets of air in the bloodstream, have circulated for years, leading to fears that even a tiny amount of air injected into the body can be lethal. But is this really true? Can the injection of air really kill you? The answer, as with many medical questions, is more complicated than a simple yes or no. While it is true that air embolisms can be dangerous, they typically require a significant amount of air to be injected directly into a vein or artery. In most cases, the small amounts of air that are introduced into the body during medical procedures like injections or catheter insertions are not harmful. So, how exactly do air embolisms occur? In some cases, they can happen as a result of medical errors. For example, if a healthcare provider fails to properly aspirate a syringe before injection, they may accidentally inject a small amount of air along with the medication. Similarly, if a needle is inserted into an artery instead of a vein, air can be introduced into the bloodstream. In other cases, air embolisms can occur as a result of trauma. For example, if someone experiences a puncture wound that penetrates a major blood vessel, air can be drawn into the bloodstream. This can also happen during certain medical procedures, such as chest tube insertions or ventilator management. Regardless of the cause, the danger of an air embolism depends largely on the amount of air that is introduced into the body. In general, it takes at least 100 milliliters of air to cause a significant risk of harm. This means that small amounts of air, such as those that may be introduced during routine medical procedures, are unlikely to cause any harm. However, if a larger amount of air is injected directly into a vein or artery, the results can be serious. As the air travels through the bloodstream, it can obstruct blood flow and damage vital organs. Symptoms of an air embolism can include chest pain, shortness of breath, and loss of consciousness. In extreme cases, an air embolism can be fatal. In conclusion, while the idea of air being injected into the body is certainly unsettling, the reality is that small amounts of air introduced during medical procedures are unlikely to cause any harm. However, it is important for healthcare providers to take steps to prevent air embolisms from occurring, such as properly aspirating syringes and ensuring that needles are inserted into veins rather than arteries. By following these precautions, the risk of harm from air embolisms can be minimized. Thanks for watching.